Hello, this is Debbie Seidel-Bickey, founder of dentalpracticesolutions.com, and I'm here this week to talk about statements, words that add value to your patients, because the number one reason why your patients will schedule an appointment and pay for treatment is because they understand it adds value and benefits them in some way. One of the most important things and the most important message that we can share with our patients is that optimal oral health leads to a healthier body and a longer life. Also, nix that word cleaning. Change it with preventive care. If your patient has periodontal disease, actually say that word disease and talk about gum treatment or periodontal therapy is the recommended treatment for periodontal disease. And then explain to your patients that they will return for routine visits, and when they have periodontal disease, you're going to mention to them they're coming back for periodontal maintenance appointments. Don't be afraid to use the word inflammation. They have inflammation in their mouth, and that relates to inflammation in the body. So share that message and use that word. Disease. If they have dental disease, if they have periodontal disease, say that word disease. Do they have bleeding gums? Many times I've worked with hygienists who said, oh, we only say B. We don't want to say the word bleeding. Say the word bleeding and let them know healthy gums do not bleed. Let them know they have areas of decay. And what is decay? Explain and educate your patients what these words mean. Break it down to them in the beginning, but let them know what the real word is, such as decay. And overarching message here is that with optimal oral health, they're going to live a longer and a healthier life. That's your message, whether it's written and also speaking with your patients. Mention that. Ask them about discolored teeth and share a shade guide with them. Ask them on the shade guide, where do you think your teeth are on this shade guide? And let them see and talk to them. This tooth is discolored and it can be like this. And show them where it could be. Loose teeth, mention to them, I do see that you have a loose tooth here. Have you noticed this tooth is loose? Even if it's slight mobility, let them know that a loose tooth with slight mobility is not normal. And is that due to grinding or clenching or periodontal disease? These are just a few of the words that I suggest. Work with your team, meet as a team, and talk about the words that you're using. For example, many hygienists are saying this is a non-invasive procedure when speaking about periodontal disease. But do your patients know what non-invasive means, or do they relate to that word non-surgical? Which words have more power? Talk with your team at the next team meeting and replace some of those words. For example, I mentioned cleaning, and use some of these other alternative words that add value. And I'll be back next week with another tip. Enjoy your week.